Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
Okay, so today we're going to continue our series talking about Hashimoto's. We're going to be more based this month on questions that seem to be more fine-tuned than maybe all the ones that we were doing the last month. So, and today the question was, what are triggers of Hashimoto's? I'm pretty sure that I covered this in one of the presentations we did last month, and since we did 30 presentations, I don't remember which one it was. So we'll do it again. So triggers versus causes. I think I'll just cover all of that. So triggers, classic triggers. So Hashimoto's is an autoimmune problem, okay? If this is the first time you're seeing this, then Hashimoto's is an autoimmune problem more than it is a hypothyroid problem, even though it's both. But what gets triggered that ultimately creates the immune attack against the thyroid that beats it up and causes it to be hypothyroid is the immune system. So what we want to know is what is triggering the immune system. So the immune system is, classically, the person already has some sort of a propensity to have Hashimoto's. Maybe they have what's called silent Hashimoto's. You actually are getting your thyroid attacked, but it's on such a low level that you don't even know you have it, or maybe you're getting some of the symptoms, but you're kind of blowing it off as other things. And then as you're going and traveling through this great journey of life, things happen. And so one of the things that can happen is pregnancy. Women get pregnant. I've had literally hundreds of women come in here and go, I was going along fine, I felt good, and then I had I got pregnant, and I felt great, and then I had my baby, and it was like the end of my life. Everything fell apart, and that's when everything began, and it's been getting worse ever since. So pregnancy can create an inflammatory response, believe it or not, and it can also cause antibody shifts. In other words, when you're giving your antibodies as a woman over to the child, it can create an antibody shift. And then if the person has the propensity to develop Hashimoto's genetically, that shift causes a lot more antibodies to be flying around that person's body than normal, because they're giving those extra antibodies to the kid, and boom, next thing you know, you got Hashimoto's. Anything that causes a significant increase in inflammation, and so stress does that. So you could have a big stress thing happen. It could be it could be a trauma, it could be an emotional trauma, it could be lots of women in here who've been sexually, verbally, physically abused, and boom, next happened. Or they were taking care of a loved one, and that loved one was dying slowly under their tutelage and care at home, or they lost, or it was a divisive divorce. These things create stress hormones. Stress hormone, the big stress hormone that most people are familiar with today is cortisol. Cortisol is actually a good hormone to have because it creates a mild inflammatory response in the body when you're attacked by anything, viruses, cuts, bruises, bacteria, and then that mild response tells your immune system to come to attack that area or heal that area. But when you get stressed, that cortisol goes way up, it creates an inflammatory response. If the person's already compromised, person already has parents have Hashimoto's or autoimmune disease, etc., then they have the genetic ability to be attacked, and so that inflammation causes the immune response. The immune response attacks your thyroid. Thyroid is the number one thing that gets attacked across the board because it's just so metabolically sensitive. Surgeries can do that. Surgery, you're under surgery. Let's say you're out. You're under anesthetic. You're out. You're like this close to being dead when they bring all of your vitals down. But what happens is when you are under the knife, as they say, your body knows that. Your nervous system knows that. Even though you're consciously under anesthesia, your nervous system knows that. And your nervous system's going like, ah, I'm being attacked. What's going on here? Like, I'm not supposed to be being attacked. Nobody's supposed to be cutting me open. And your immune system will, your cortisol levels will go up. I've seen estimates of 2 to 3 to 4 to 500 times. 100 times. And so when that cortisol goes up that much, then that'll set off immune responses. And that's a common thing I hear it all the time. I was doing fine. I had hip surgery, and all of a sudden, like, you know, I'm putting on weight, my hair's falling out, my gut's bad, and I'm fatigued, and then they go ask their doctor if the hip surgery could have had anything to do with it, and the doctor always says no, and the doctor probably legitimately doesn't think there's anything that it could have been, but so that's another one. And and injuries. See a lot of people got in a car accident, hurt my back. You know, I was just talking to a gentleman this morning. He was playing football, and then took a particular hit, got a concussion. Next thing you know, boom. So it could be an injury, a whiplash. It could be that you hurt yourself that way. So those are the biggies: injuries, stress, surgeries. Overwhelming infection would be the last big one. Overwhelming infection. For me, I got into this, for those of you who've never seen me before, I got into this because I have a lot of this stuff, and I do have Hashimoto's, and it was I was under a lot of stress at the time, and then I got pneumonia, and boom, that was it, off to the races. I had you know, I started getting a lot of symptoms of Hashimoto's and hypothyroidism, and then that morphed into a little bit of kind of like a fibromyalgia, peripheral neuropathy type of thing. So I had two triggers right there. But overwhelming infections, obviously, flare up immune responses in an effort to dampen those, to kill the infections. And then in the meantime, again, you always hear me say if the person has genetic like propensity, they have the genes that say it's okay to attack me because I have family members who have autoimmunity, then those are the people that get it. Now those are triggers, those are not causes. Now when we get into causes, now you're talking the different viruses and the bacterias and things that make us susceptible, like immune barrier stuff, in other words, leaky gut, those types of things. Food sensitivities are not causes. They're certainly not triggers. Food sensitivities I'll take that back. Food sensitivities can trigger autoimmunity. But usually that doesn't happen until one of these other things has set off an overall general response. And then you eat the food sensitivity and it flares you up. You don't eat the food and you're kind of fine. So those are a little bit more, those are a little different than what I think this question is asking for. I think this question was like, I was walking along, everything was fine one day, and then all of a sudden it wasn't, and now I have all these Hashimoto symptoms, and how did that happen? So I think I've answered that question. And if I haven't, you let me know, but I think that is probably it. So, okay? See you with another one in a couple of days.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.